Being a pediatrician is one of the most enjoyable jobs we can have. Over 20 years, we see children grow and thrive and become young adults. The job of a child is to grow and develop in a healthy way, and so we can make sure that that is happening.
Their pediatrician is awesome. When we go home after a visit and they gotten shots, they still can say, like, I was happy to see Dr. Brindle, and I think that's awesome. She's amazing to my family.
Continuous health coverage from birth through age 5 up until their 6th birthday is important because, it reduces those gaps in coverage. It also promotes, better preventative care, better wellness checks, greater immunization rates.
Continuous Medicaid coverage, first and foremost, benefits the child and benefits the family and the patient. When families lose coverage and then need to re-enroll and lose coverage and then need to re-enroll, that creates a very large administrative burden. It creates a burden for the family, and it also creates a burden for the state agency.
When children and families don't have insurance, it really creates a financial barrier and stressor. Families can incur much debt because of not having insurance.
I know a few families who struggle due to not knowing how to access it or not being able to qualify for it.
It feels challenging as a pediatrician when we cannot help families overcome and thrive because they need things that are outside the scope of our office.
It would be really hard if I didn't have health insurance for myself and also for my children. We need services that if we needed to pay out of pocket, it would be impossible.
Oregon just passed this birth through 5 continuous coverage, and it's the first state to do so, and there are about 3 other states that are in the process of pursuing this continuous coverage.
All of that early childhood wellness that is happening and being screened for in the pediatrician's office translates to the child's success as they prepare for preschool and school entry.
I feel grateful for the care team that my children have. It's easy to use my voice for them because I am their voice. So I feel like it's so easy to voice my opinions and be heard.
Sometimes things do go awry with illness, with mental health, with child behavior, but when we already have a long-standing relationship, we also know that they have many strengths unique to them as a family, and helping them identify their strengths, helping them remember who in their community loves them and supports them. That is, I think, what a good longitudinal relationship with your primary care pediatrician can be.